Is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is Friday, November the 13th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, Heather Saunders, Nursing Program Consultant for MDH, Patricia Sastoque, Director of Programs, Valerie Roddy, Director of Fiscal and Operations, Rhonda Workman, Director of Federal Programs. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is a handout for the webinar, and you can find it in the handout section in the panel to your right. They can also be emailed upon request. We will be recording the webinar, and we will post the YouTube link on the DDA website. Questions can be typed in the question box in the webinar panel on your right, and we will answer those towards the end of the presentation. And now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon. And I'd like to welcome everybody again for attending our Friday webinars. Obviously, hopefully many people who are on the webinar did see the governor on Tuesday and Thursday with the press conferences that he held, and concerning about the increase in the numbers and encouraging people to wear masks, etc., and really concerned about the numbers. Also stating that Maryland is not in the same situation as some other states. So again, we will, if you didn't see it, I would suggest that we can get a link out and you can view the governor's press conferences. So today we're going to share our updates, and we've got the opportunity to have Heather Saunders with us. She's a nursing program consultant at the department, and she's going to talk about the CDC's policy on COVID-19 coming up with the holidays and visitation protocols, etc., especially with Thanksgiving being around the corner, and then the additional holidays coming up. You may recall that Heather did a presentation with us back quite a few weeks ago about PPE and how to wear PPE, et cetera, et cetera. So with that, we can go to the next slide. So again, our highest priority is everybody's health and safety and well-being, all the people that we provide supports to, their families, our staff, providers, et cetera. And we need to remember that this is a critical time, especially with the fall and winter and the flu and COVID and everything that's going on. And we need to remember to practice health and safety with washing our hands, masks, social distance, et cetera. And again, as I just said, the governor did announce this week on tightening some restrictions. I think we went from 75 back to 50% on some of the areas of concern that were like in restaurants, et cetera. And so he also is strongly discouraging to have gatherings of more than 25 people, that are indoors, et cetera. And only because there's a lot of people who have been looking like they've been in small gatherings and obviously coming back and testing positive for COVID. And so as the governor said this week, we've crossed over into the danger zone. Too many residents and businesses have COVID fatigue, and maybe they're letting down their guard. And he reiterated a strong warning to everyone. And again, if you don't have the link to the governor's, and it should be on YouTube for people to take a look at it, I do encourage you to take a look at the governor's message. Next slide, please. So for PPE, we have had 5 rounds that we've distributed across all of the regions. We'll continue to advocate for another round. And the health departments basically have some PPE. And the other issue is I want to raise this as a point. When the pandemic started, there was a lack of supply of PPE. And now the supply chain seems pretty good. So, I would encourage people, if they have an opportunity, to maybe try and even purchase some of their own, because we'll see if we can get another round, but again, the supply chain is not as low as it was initially when everybody was out looking for PPE initially. So if you're having a hard time with the health department, please contact the regional director in your region, and we will follow up and start taking a look at that. And in the message, the governor, within the last two press conferences, encouraged the county leaders to utilize the remaining CARES money. That money basically has to be spent by December 31st. And so we know that there are PPE, and particularly on gloves and gowns and masks, etc. And so we know that there's been discussion with the nursing homes to have a 60-day supply, etc. So, and some of the nursing homes obviously are purchasing their own. Of the money that the governor announced, there was I believe $70 million that's been released, and $15 million was for unemployment, an additional $20 million for funding PPE, $15 million for unemployment, $10 million for relief for people who are renting, and then $10 million for vaccination planning, etc. Area food banks, etc. Next slide, please. So there's been a lot of discussion, and we had the opportunity to present to Max yesterday, and have other discussions about where we are with Appendix K. This slide is a reminder that DDA is working closely with our partners in Medicaid and CMS, and also with the State Directors Association. And where we are looking at flexibilities on Appendix K, how we do this. This is not solely a DDA area that we have responsibility for. We have to work through our Medicaid office in the department and get permission for CMS. I will tell you that I was on a call yesterday with some of my peers, state directors, and I just want to point out that I think we're very fortunate here in Maryland that we have had the opportunity to have retainer days. I know some people have been frustrated with it, but I can tell you there were two states on the state DD directors call yesterday that basically do not have retainer days at all, none. And there was one of those states also is still trying to get their direct support professionals basically considered essential personnel. And we know that the governor had put that in one of his earlier orders, that our folks, our DSPs, were essential personnel. So again, I think we've been fortunate in this state. We are again looking to get up to the 30 days so that providers can have access, and then also remove the quote unquote consecutive days, so that it's not just consecutive as for billing, but it's just based upon the appropriate services that people are in. Next slide, please. So we also wanted to just give a quick update on where we are with an at a glance slide here on where we are with EVV. I can tell you that this has been going on for a long time, from when this was passed by Congress, the U.S. House and the Senate. Again, to reiterate, CMS does not have the authority to postpone or make any changes. This is totally with the U.S. Congress, House and Senate. And so the chart on the left shows about where we are with compliance with the state, 60%. and then where we are by regions below that. And then on the right is where we were with Go Live. And as you recall, our Go Live was October 1 for West and East regions. And then the South region was 11/1. And we're making quite a bit of great headway in the Central region and where we are. So congratulations to everybody there, knowing that that's the largest region. And you know, I know we will be successful in meeting our target. Next slide, please. So we want to give a little update on where we are with billing as of November 1 and the percentage of tracking for the interactive voice response, the IVR, and the usage, etc. I think the key takeaway is that the EVV system is lower than we expected. Because there are a lot of participants who basically have elected not to have personal supports due to the pandemic. So we will keep an eye on this. We will continue to track and take a look at the participants' activity and where we are in the billings as we continue to move forward. Next slide, please. And so let me give you an update so that we can tell you this is in real time as of yesterday afternoon of where we are with the people who have either tested positive or negative or unfortunately have passed away. So in the South region, we have 301 confirmed positive cases, 126 negative, 6 pending, and we have had 18 people in our support who have passed away. In the East region, 59 have tested positive, 225 negative, 12 pending, and there have been no deaths in the East. Central region is 345 positive, 686 negative, 35 pending, and 20 people in supports who have passed. And in the West region, 61 positive, 267 negative, 7 pending, and 3 people have passed away. As far as staff that have been reported to us in the South region, 204 staff have tested positive, 5 people have passed away. In the West region, 79 positive, 1 person has passed away. In the East region, there's been no deaths and 102 positive. And in the Central region, there is 371 and 2 people have passed away. Next slide, please. So again, this information is of week ending yesterday, 11/12, from when we pull this, and you can see that our number stays about constant with about 96% of the people in services and about 4% of those individuals who have tested positive. And then obviously we break that out because the pie charts statewide, and then we break it out by region so that you can take a look at wherever your agency or your family is, if you're self-directing, et cetera, or individuals, what that looks like within those regionals. So here we are with the next chart for our tracking and what we look like. We have gone from 39 deaths to 41 deaths since our last 2 weeks ago when we did the webinar. And the pie chart on the right obviously shows the number of people who have tested positive and the number of people who have died of the people who have tested positive, the 807. And so, you know, these numbers aren't good at all, but again, we wanted to share and so everybody's aware of where we are with DDA. And with that, I'll end and be able to take any questions later on when we open it up for that. And now I think Rhonda Workman's going to pick up.
Thank you, Bernie. Next slide, please. We just wanted to share a little bit of update about some enhancements to our website and some resources that may be helpful for you. So to support our stakeholders' awareness of the information that's going out, and we send out information through constant contact and email blasts that go out. If you want to join that list, you can see this on the slide where it says join our mailing list. But because there's a lot of critical information going out, not only related to COVID, but also to our transition to electronic visit verification, policies and such. We've enhanced our What's New at DDA dedicated page, which is demonstrated here on the screen. You can access it by clicking on the What's New at DDA. And we have added under the heading DDA monthly communication highlights, summaries of each month's information and communication that has gone out via constant contact or updated, revised on the DDA website. And so you'll be able to click on the specific month and see the updates that are there. These highlights are a quick reference to the various communications that are shared either during that week or during the month. Next slide, please. This slide is a demonstration of the communications highlights for October, and you can see that we have organized information in a PDF when you click on it so that you can see the letters and memos that went out during the month of October. We have also organized topic-specific communications noted there, and you can see that there were several related to EVV, LTSS Maryland, person-centered planning. We had a few on policies and then some other communications. And in addition, we have included the links to webinars that occurred during that month. Next slide, please. One other thing that we wanted to highlight, when you're on the DDA website, at the top, we have a banner with quick access links to various priorities and topics. We have added person-centered planning to the banner so that when you're on any page of the DDA website and you want to get back to person-centered planning and the various resources there, you can click the banner at the top and it'll give you a quick access to person-centered planning and all the information and webinars we've been posting. I'd like now to introduce Heather Saunders from the Nursing Program Consultant at MDH to share some information about the holiday seasons and COVID. Next slide, please.
Thanks so much. Can you hear me okay?
Yes, we can hear you. Thank you.
Excellent. Well, thank you for having me today. Really appreciate the opportunity to be on this call and to speak to you all about this really incredibly important topic. And I know we've been hearing a lot about this from the media and of course from our department, the Maryland Department of Health, about the importance of mitigating the spread of COVID-19 during the holiday season. And I think none of us would have predicted that we would be here at the end of 2020 talking about, again, the COVID pandemic and how do we mitigate the spread of this disease during the holiday season, but definitely an important topic. So glad to be here and talk with you all today about this. Next slide, please. So just a couple objectives about what we really want to cover today on the call. We're going to review, again, COVID-19, just the basics about how to stay safe that we've been implementing in our homes, in the community, and in our programs. Also talking about discussing concerns around the spread of COVID-19 during the holiday season, why this is such a concern, and you're hearing so much discussion about this and recommendations coming from, CDC, the State Department of Health, about how do we mitigate this virus during the holiday season. And then we're going to transition into reviewing some options about how do we modify our holiday plans? How can we stay safe and still enjoy the holiday season? Followed by some opportunity for questions and answers for all of you. Next slide, please. So COVID-19, how to stay safe, just reviewing a couple of really key important measures to prevent COVID-19 infection in our homes, in the community, our programs. So next slide, please. So how does it spread? Let's just back up to the very beginning of understanding the transmission of COVID-19, because in order to stay safe, we really have to understand how this virus is transmitted from one person to another. And mainly just that, it spreads easily from person to person by droplets. And those droplets could be spread when an infected person is talking or singing, even breathing, or of course coughing and sneezing. And this is primarily between persons that are within 6 feet, close contact with one another. For a cumulative maybe 15 minutes is what we use as kind of our contact definition in public health when we do our contact tracing. So we know that it spreads easily by droplets, and that's really the primary route in which this virus is spreading, from person to person by droplets. But it's important to note too that people can be infected and not have any symptoms and still spreading this virus to others by droplets, and also less commonly by contaminated surfaces, or sometimes smaller airborne particles and short-range aerosols, as we've seen in some situations and some outbreaks and in some studies. So primarily by droplets from person to person, sometimes by contaminated surfaces, much less frequently by contaminated surfaces, and then that airborne or small aerosol droplets. And again, it's just important to note that people can be infected and infectious, so passing this from one person to another, but not actually have symptoms, which I think is one of the reasons that COVID-19 has been so difficult for us to control. Next slide, please. So again, back to the basics of what should everyone do. At minimum, everyone should do the following. We know and keep talking about needing to wash our hands often, either using soap and water hand washing preferably, but then also hand sanitizer, the use of hand sanitizer, ensuring that we're appropriately performing hand hygiene. And then avoiding close contact. So we talk often about social distancing. We hear this all the time. And it's again because we know that COVID-19 is spreading by droplets from infected persons when they're in close contact with other individuals. So maintaining that social distance is really important to ensuring that we are preventing transmission of the virus, so avoiding close contact. And then wearing a mask, whether that's in the community, in our programs, wearing a mask that covers your nose and your mouth, fully covers your nose and your mouth. When you're within that close contact, that 6 feet of individuals from outside of your household. And we're going to get into that in a moment, because I think that's something that a lot of individuals miss out on understanding, particularly around the holiday season. But we're wanting to wear that mask around anybody that's not within our own household. And then appropriate respiratory etiquette. So we're always covering coughs, sneezes, not using our hand to cover cough sneezes, but using that elbow, cleaning and disinfecting environmental services and surfaces, very important. We know that COVID-19 can minimally be spread by contaminated surfaces, so we want to make sure that we're cleaning and disinfecting those surfaces appropriately, continuing to do hand hygiene after disinfecting surfaces, and then of course monitoring our health daily. COVID-19, although it can present as asymptomatic infection, oftentimes does produce signs and symptoms, and we want to monitor for those signs and symptoms and make sure that we're staying home if we're not feeling well and seeking testing. So more information about preventing getting sick, what to do in the community and programs, that can be found on that CDC website posted there at the bottom of that slide. Next slide, please. So now let's get into talking about the holidays, the importance and considerations around how do we prevent COVID-19 during the holiday season? What are the concerns, and what are some ways that we can mitigate the concerns and the risk of spreading COVID-19 during the holiday season? Next slide, please. So again, the current situation, where are we at right now this November in 2020? So we see that the COVID epidemic in the United States and in Maryland is worsening. We reviewed some data, earlier in this presentation. I know the governor reviewed data. You all had the opportunity to take a look at that. And then we have data posted on that Maryland coronavirus website that just shows the gravity of the situation currently, where we see hospitalizations increasing, the rates of infection and the percent positivity is increasing. We're even starting to see some of the numbers of deaths of individuals with COVID-19 increasing as well. So very concerning, the trends that we're seeing across the United States and in Maryland, all over Maryland. And one of the things that we know about the current situation of COVID-19 is that small household gatherings really are a contributing factor to the rise that we're seeing in cases. We talked about those really basic, important prevention measures in one of the previous slides. And one thing to note is that sometimes individuals feel really comfortable in their friend and family situations when they're having small gatherings. The social distancing, they lax, and the masking, they usually remove those masks. We're seeing this quite often in our contact tracing throughout the state, and really encouraging people to, even in those small gatherings with maybe extended family or friends where folks might feel really comfortable with those individuals, that they really continue to ensure that they're social distancing, ensure that they're masking, performing hand hygiene, even when they're in those small gatherings with friends and family, because we've seen, like I said, that household gatherings are contributing to a rise, and that we can really slow the spread of COVID-19 by modifying those gatherings, or at times wanting to avoid those small gatherings to ensure that we're doing our part to prevent the current situation from worsening in the United States and in Maryland. Next slide, please. So what are the concerns for the gatherings? What are the concerns around holiday gatherings? I think the picture here to the right says it perfectly, and this is what we're typically used to doing at holiday gatherings. We're gathering with our family and with our friends to celebrate holidays. Oftentimes we're having dinner around a big table, and typically there's, of course, in previous years not been social distancing and masking. And so to really avoid worsening the transmission of COVID-19, we're going to have to modify the way that we celebrate the holidays. And it's not going to look like this picture to the right that you see on the slide. And so modifications are going to have to be made. We want to prevent the further spread by avoiding and modifying those holiday gatherings. So next slide, please. So some considerations. Let's start out talking about kind of the spectrum of risk for holiday celebrations, all the way from the lowest risk to what we can perceive to be higher risk situations for holiday gatherings. So the lowest risk would really be avoiding these small in-person gatherings. So celebrating virtually, there's lots of great recommendations out there on virtual celebrations with family, friends, that can be done with members of your household. Celebrating with members of your household is another option, and then setting up that virtual option so that you can celebrate with the members outside of your household. That's going to pose the lowest risk for continued spread, is if we don't have those small in-person gatherings, but stick to our own households, and then include others virtually so that we can continue to celebrate the holidays together. So medium risk, moving on from there, medium risk would be going ahead and having those small indoor gatherings, but they are socially distanced gatherings, and masks and social distancing is observed and they're reinforced. And again, going back to a lot of times on the holidays, we have dinner around a table, a big table together with family, and we want to avoid that situation and not have this communal style dinner around the table, but we're going to sit in different tables potentially, at least spaced 6 feet apart. If we have the option to have outdoor small gatherings where we also observe that social distancing and masking, then we want to preferably do that as well. So that's kind of the medium risk situation. And then a high risk situation is one in which we are celebrating the holidays like we have in previous years, with large non-socially distanced gatherings. We don't have masks. Again, we're not doing the social distancing. So likely this looks like the previous pictures where we're gathered around the table, no masks, no social distancing observed. This is a very high risk situation because, again, we're seeing some of the drivers of transmission in the community be asymptomatic individuals that are infectious but are not showing any signs or symptoms of COVID-19. So you can find out some more information about kind of the risk stratification around the holidays at that website there posted to the bottom. And there's also some other great information on that CDC website about mitigation strategies, which we're going to talk about in the next several slides. Next slide, please. So first, who should not attend a holiday gathering? When we talk about any sort of in-person visitation or in-person gathering, we want to first talk about who should not really be attending those. First of all, of course, anybody that has signs or symptoms of COVID-19 should not be attending a gathering. If you yourself are attending in any sort of in-person, socially distanced, even outside, dinner with family or friends, on top of it, ensuring that masks are going to be worn and social distancing is going to be observed. We also need to make sure that everybody understands that no one with signs or symptoms of COVID-19 should be presenting to that. And then furthermore, anyone that's been exposed to somebody with signs or symptoms of COVID-19 in the last 14 days, they also should not be presenting to any sort of an in-person event or gathering. And then CDC also notes that anyone that has an increased risk of severe illness from COVID-19, whether they're an older adult or a person with certain medical conditions that's at an increased risk of illness, or maybe they live or work with someone at an increased risk or illness, they should also avoid in-person gatherings with people who don't live in their own household. So they should stick with that low risk, virtual and within their own household celebrations. Next slide, please. So let's consider what are some ways that we can reduce the risk of holiday gatherings. I think we all are a bit saddened by the fact that we have to modify and possibly even avoid the holiday gatherings that we've come to know and love so much during the holiday season. Multiple holiday gatherings that are going to be coming up that we normally would celebrate with our family and our friends. And we want to talk about and give some options around how we can continue to celebrate and enjoy the holidays while we are reducing the risk of spreading COVID-19. So number one, again, would be celebrating virtually. I think there's some great ways in which we can put virtual celebrations together that are going to still allow us to be with family, be with friends, and reduce the risk of spreading COVID-19. Some folks are opting to just have celebrations with their own household. I know that's what my family is going to be doing this Thanksgiving, just having Thanksgiving dinner with my husband and my kids. And then limiting the number of attendees. So we're going to limit the number. We're not going to have a large gathering because we want to enforce social distancing and enforce masking. Those are really important aspects of making sure that we're mitigating the risk of spreading COVID-19. And then other options include hosting outdoor gatherings. So if the weather is favorable, take the gathering outside on the deck. Make sure that tables are spaced away so that households can sit with their members of their own household and ensure that that social distancing is in place. That really reduces the risk having that outdoor gathering. And then avoiding potluck style dinners is another option. Having folks bring their dinners with them, or avoiding passing food around the table, but serving in a single place and bringing it to their table. Those are some options for avoiding the risk, avoiding having to come in close contact, without masks or breaking the social distancing. And then again, I think that this is a really important point, and one of the reasons that the holidays is so concerning, because typically when we are around a table with family, we're not going to, of course, be wearing masks. We're going to be eating, and that increases the risk of spreading COVID-19. So when we eat meals, if we're eating meals together, we want to make sure that we are at least 6 feet apart, and with the members of our own household, and not gathered around that table without masks eating together. And then it's also often mentioned that we want to avoid risky behaviors, such as excessive alcohol consumption would be one example of that, just because that really, of course, lowers our inhibitions and increases the risk that individuals are going to take their masks off or not perform effective social distancing. So that's another really important point. And there are more actually options for reducing the risk of holiday gatherings, other ideas that are out there that are posted on that CDC website that I would encourage you guys to take a look at. Next slide, please. So how do we talk about this? How do we begin to communicate with staff and residents or families regarding the holidays? Because this is a really difficult and sensitive topic, I think. We want to ensure that we are enjoying the holidays, that we are having the opportunity to be with family and be with friends while preventing the further spread of COVID-19. And this is a really big concern, you know, in the public health arena, that these holidays are going to increase the transmission of COVID-19, the spread of COVID-19. So we want to communicate with our staff, with our residents, with our families. We want to make sure that they understand these concerns, that they have the information that we're providing in today's presentation. So one way that you can do that is host a virtual town hall. Get people together over Zoom or another platform to discuss these concerns. Let them discuss concerns with you. And it gives an opportunity to educate and to acknowledge that these are concerns and that we're all, you know, kind of in this together and wanting to together make sure that we're mitigating the risk of spreading this virus. It'll give you the opportunity to share and review that CDC information that we've shared on the call and that we've provided a link to. You know, share that information and do that through your virtual town hall and your emails, phone calls. And I think the more we get this information out there and help people to understand that we're not saying to skip the holidays, we're saying to modify what the holidays look like based on the levels of risk that present in our community and in our homes. And discourage out-of-state travel at this point to states that have greater than 10% positivity. That is part of the state's new order, as individuals are going to have to come back under a 14-day quarantine if they travel to any state outside of Maryland that has that 10% greater positivity. And at some point, I'm afraid Maryland might be there as well. So really, they need to also think about the fact that where they travel within the state, if they're even traveling within the state, they could be traveling and joining a gathering that's a higher risk than even one that would be out of state. So we need to just be frank about those conversations and transparent with folks about what the risk is and where they should be concerned and how they should modify their gatherings or their holidays. And then provide opportunities for participation in virtual celebrations with family members. I think this is an important one. Again, we want to make sure that we provide those opportunities for celebrations and do it safely. So let's provide those opportunities for virtual gatherings so that families don't feel the need to have to take residents out of homes to bring them home for the holidays in these larger, not socially distant settings. And then requiring 14 days of quarantine is reasonable for residents that are coming back, returning from holiday gatherings. If that is indeed going to happen, I would say that that is situations that we want to try to avoid through these conversations and communication with our families. However, if in the event we do have residents that are going home for the holidays, or visiting, then we want to make sure that they're coming back under quarantine for 14 days because we do see it as an increased level of risk to not only the residents and families, but to the communities. Next slide, please. I want to take the opportunity. Just wanted to see if anybody has any questions.
Oh, they do. So I'm going to read you the questions, and they're a little mixed because there's some for DDA and for you. So what I'm going to do is I'm going to read all the ones pertaining to you, and then as we have time, if things come in, then we'll do the ones related to the DDA and then some specific people. Because sometimes people ask questions that have nothing to do with the actual presentation, but there are DDA related questions. So let's see how we do it, Tom. So the first question that we have is that we have seen outbreaks managed differently depending upon the epidemiologist. For example, one Baltimore County doctor requires 2 negative COVID tests for all persons before the location is released from outbreak, even though the Lawrence lists show no one has symptoms at all. tested negative ones already. Can you break out management be standardized?
Yeah, no, that is a really great question. And I'm glad that you're asking that question because it gives me the opportunity to kind of give a couple of various explanations. And one of which is that every outbreak is very different, and the epidemiology of the outbreak can be different. What is recommended is therefore oftentimes different because we really have to approach that outbreak individually. And so for some outbreaks, we might make a recommendation to stop something, and for others, we might be okay with that continuing, whatever that thing may be. And so it really is an individualized approach. Certain recommendations and certain guidance should be standardized. And that's where I just want to explain that Maryland is a shared governance state. And that means that every local health department does have the opportunity to impose further restrictions in some situations and settings beyond the minimum standard that's set by the state. So oftentimes we will release specific guidance, and sometimes the counties are allowed to go above and beyond that guidance because we are a shared governance state, and the local health department does have kind of the ultimate authority over those investigations and those outbreaks in coordination with, of course, the state investigator. So there is some variability, but that variability is somewhat built into the way the state is run, and also built into the fact that every outbreak is very unique and has to be approached in an individual sense.
Thank you, Heather. So the other question, as you know, some of the folks that we support love to go home for the holidays with their family. Do you have other additional guidance when families want to take the loved ones home for the holidays in addition to what you shared?
Yeah, no, that's a really great question. And I think just to kind of repeat a couple of things that I shared, I think the first thing that we need to do is try to approach this by having a conversation with the family, sharing concerns, sharing the concerns that were posed on this call, the concerns of MDH and CDC, and the recommendations for the virtual gatherings and how we can make those happen. If, however, we still have family members that are wanting to take residents out of the facility for some sort of a visit or gathering, then making sure that they have that guidance on the importance of social distancing, the preference of outdoor over indoor, masking, all of that guidance I think is really important to make sure that we're just arming them with as much education and information as possible. But aside from that, like I said, when we do have a resident that goes out into a situation that we deem to be a higher risk situation such as this, we do have the ability to put them on quarantine for 14 days upon return and observe for any signs or symptoms of COVID-19 during that period of time. And I think sharing that, ensuring that family are aware of that policy and the reasons behind that, I think it's really important to share the reasons behind that, would be kind of my standard recommendation. I think it's going to take a lot of communication and education, and I think we just have to have policies prepared in advance for what do we do when a resident does come back from something that we are concerned was a higher risk situation like this. And I would recommend, and we would recommend at MDH, the 14 days of quarantine.
Thank you, Heather. Somebody wanted you to clarify the travel. If it's less than 10% positively, do they still need to quarantine for 14 days?
Yeah, great question. So the state order is that it's 10% positivity coming back in, that they should be quarantined for 14 days, tested for COVID-19. So less than that, there's not a specific, specific recommendation for quarantine that is mandated. I think it's important to, again, have those transparent and frank conversations, because if an individual, say, is going to drive up to Pennsylvania, actually, I don't know what the percent positivity in Pennsylvania is. I shouldn't use that as an example, but if they're going to drive to a state that's less than 10% positivity and have absolutely no contact with people because they're camping in the woods alone, that's a much less degree of risk than an individual that's going to be in one of the highest percent positivity counties in the state of Maryland at a large family gathering. And so where are they traveling and for what? And having that conversation about what is high risk and what is low risk when trying to determine whether there needs to be any additional action taken for somebody that travels to an area outside of the state for less, that's less of 10% positivity. We in general just want to discourage those higher risk situations and encourage the social distancing and masking. So hopefully that kind of answered the question there.
So Heather, let's take this one a little further. So the quarantine, should they quarantine within the home they live in returning, or do you recommend that they find another location to quarantine?
And I guess it depends on the situation in which you're speaking, or the person of which you're speaking about. I guess if it's staff would be technically quarantined within their own homes and not the programs, but residents, of course, within the home, the program in which they're located, they could quarantine there.
Okay, thank you. Lots of questions are coming in, so I'm trying to keep up with some of them. One of them is an example I'm going to give you, and maybe you can provide some directives. So if a resident at ABC facility tests positive, are all residents made to take a COVID test, or just those symptomatic?
So if a resident tests positive within the program, it may be recommended, and again, this is that kind of individualized approach depending upon the situation. So let me give an example as an answer. So if that resident that tested positive had, recently had exposure to a positive staff member, say, and the staff member also cared for other residents in the program, then those residents we would be recommending testing for regardless of signs or symptoms. Again, people can be asymptomatic. And same with, in the situation where this resident tested positive, if they had interactions with other residents in the program, or it's likely that they did, then we likely would be testing those residents as a measure of identifying asymptomatic infection and preventing further spread. And sometimes we actually do that in a serial manner, or recommend that in a serial manner in certain outbreaks, to again quickly identify infections and be able to contain those infections. And it is, again, on a very individualized approach for each outbreak based on the epidemiology of the outbreak.
Thank you. I know Dr. Fetter had said that we consider them as an outbreak and all should get tested as previously shared. So we just wanted to be sure.
Right.
That we get
Yeah.
information.
Yeah. That sounds right.
There's one, they just came in, and I'm just putting them all out here so people can see that we're reading all of them as much as possible. Recent studies show that indoor gatherings result in transmission regardless of the mask wearing and social distancing. So they're a little concerned at some of the things that we're saying and that you're saying in reference to what they're seeing that recent studies show. Now, I'm not sure that in quote where they got this information or what study, but this is what's been written in the chat.
Yeah, no, and I mean, that's a really great point that you make. And I think I've seen some of those studies, and we could kind of theorize about why that might be, one of which might be that masks weren't being worn appropriately. We see that all the time out in the community where masks are being worn under the nose or not fully covering the mouth. That's of course a concern, or social distancing not always being adhered to. There's also some studies, and there's some of the concerns about a limited airborne transmission, short-range airborne transmission, where there's smaller droplets, where there might be those concerns when there is a symptomatic or asymptomatic individual that's infectious at those areas. And I think that's why we also really just encourage to try to avoid the smaller indoor gatherings, and to ensure that people are masked appropriately and socially distanced when there are, because there are those concerns. And it's why it is more of a medium risk situation versus a low risk. So it's a great point, and appreciate you bringing that up.
Heather, do you have additional guidance related to going out to dinner as a one-time event? Like some people just want to go just like, maybe that Thursday night together within the home, but then not be in the same bubble. So can you advise or get additional guidance on that?
And just to clarify, are they asking about going out to like a restaurant for
They didn't know. They just said, do you have any additional guidance related to going out to dinner as a one-time event? So I don't know. Let's see if they type anything additional in the chat box, but that's just how it's written here.
Again, outdoors is always safer than indoors. If you are having those sorts of gatherings, anyway, you can have sort of an outdoor gathering, socially distanced, masked, ensuring that we're following those safety measures that we talked about in the beginning of the call. Otherwise, and if there's additional questions that maybe I just didn't answer very well with that, providing that answer, feel free to type those in the chat box. But otherwise, I think that's the main thing that we need to ensure we have in place, is that social distancing, that masking, outdoors versus indoors, and really trying to focus on doing these kind of virtual gatherings as well. Actually, one other thing that I didn't note or didn't mention, one recommendation is that everybody that is planning to be in the gathering quarantine for 14 days prior to the gathering. That's another recommendation. I think it's a great recommendation if people have the opportunity to do that. The household quarantine for 14 days prior to getting together to ensure that they're not putting one another at risk. And they would still do social distancing and masking, but it reduces the risk of the gathering.
Thank you, Heather. We appreciate that. I have some questions from some of the DDA staff. And Rhonda, this is DDA looking at extending COVID isolation payment past the 21-day limit to assist providers who have a second outbreak in a location?
Yeah, thanks, Patricia. That's a good question. That question was posed to us by Max during the Max General Membership meeting yesterday. And our response to that is at this time, our current standard is up to the 21 days, but we can look into it and we'd also need to do a fiscal analysis related to costs related to that. Valerie, did you want to add anything?
No, I think you covered it. Thank you.
Okay, thank you. This is another DDA question. Is our facility, and other Heather can answer it too, are facility caregivers accountable for wearing masks during their shifts? And I would just say, based on the governor's orders, based on what you heard Heather talk about, we expect everybody wearing masks if they are a caregiver and working with a person that we're supporting. Heather, do you want to add anything to that?
No, I would just echo that, and we've seen that this has been incredibly important in mitigating the spread of COVID-19 programs. So I absolutely agree.
Okay, and here's one. Over the summer, spring, DDA let individuals, providers determine their own criteria for family visits. Is this still the policy, or is there a more uniform policy for the holidays? That's a great question. DDA has always been at empowering the providers based on the information, the education, everything that's coming out from the CDC, the health department, the governor's office. And so we will continue to do that. And what we're doing is we're just providing additional guidance. We're opening up the mic for people like Heather or like Dr. Feder to be able to share. But this is, again, this is your business. This is your management style. Our number one priority is the health and safety of the people that you support. And so we would want you to adhere to those policies and requirements. So we are going to be flexible. We're just sharing a lot of guidance and information so that you can focus on making sure the folks are health and safety. I don't know if Valerie or Bernie, if you wanted to add anything to that.
No, I think it's fine. Again, the priority is always about health and safety, no matter what.
Great. Valerie, I have a question for you. Should we continue to wait for further guidance for the retainer date consecutive requirement, or will error updates still be due by December 31st?
I'm glad someone asked that question, and the answer is yes, please hold. We are still working, our Medicaid partners are assisting us in our conversations with CMS, and we hope to have some affirmative clarification in the future. In the meantime, however, I would really urge providers to hold off. As soon as we know something, we will make sure to notify providers immediately.
Thank you, Valerie. The other piece, this is a DDA question, is virtual day program going to be an option going into 2021 for those who have shown increased improvements in energy and health status? Rhonda?
Yes, Patricia, thanks for sharing that question. The answer is yes. Our current Appendix K is still in play in January, and so individuals who choose, or it's the best option for them to receive remote supports or virtual supports, then that can continue into 2021.
Okay, thank you, Rhonda. And I'm just reading some more questions. Here's one, and Heather, I don't know if we even have the answer for this, but this came early on in the presentation. Is the national death rate for COVID-19 is 2.5% of positive cases, while DDA's death is 5% double. It's actually 4% of positive cases. Why is this? Is anybody looking into this? So Heather, do you have any comment you want to share with that?
So when you're looking, and I don't have the data directly in front of me to corroborate or analyze that data anymore, but I can say that when you're looking at data, and data specifically for the United States as a whole and then DDA, you're looking at data for a whole population, and then you're looking at data for a specific population. So now if you were to look at data specifically, the percentage of deaths, for example, for individuals that have specific medical diagnosis as maybe obesity, where we know that that is a severe risk factor for severe illness of COVID-19, you're going to see a higher death rate for those individuals than you're going to see for a whole population. So sometimes it has to do with risk factors within a specific population, but you're not really comparing apples to apples when you're looking at those two metrics. You're comparing a whole population, the United States as a whole, to a specific population. And so that the rates are going to vary depending upon the risk factors of the population. So hopefully that helps a little bit, and I can see if there's any additional information that I could provide at a later date.
Thank you, Heather. And the last question is, if providers decide to support home visits, should they have a test prior to and then a test returning, and should they still quarantine?
Sorry, you cut out there for a moment. Can you repeat that question?
Sure. If providers decide to support family individuals to go visit their families, do you recommend that they be a COVID test prior to them visiting, and then upon returning, and then also quarantine for the 14 days?
So there is the recommendation out there that when families are visiting, that having a COVID test is a great tool in ensuring that we don't have individuals with asymptomatic infection visiting. And I think that that's a great recommendation if we can implement that. And then as far as the quarantine of the residents is what I'm assuming they're referring to, recommending the quarantine of the residents. I think it depends upon the situation. It's not a standard recommendation that we would have to quarantine for a visit. If, for example, there is a situation in which there is a concern for exposure, such as that social distancing is not observed or masking is not performed that is observed, for example, or the individual that's visiting does subsequently test positive for COVID-19 a couple days later. Those are situations in which, yes, we should implement that COVID quarantine, but in general, the visits, as long as social distancing is maintained, and masking is performed, outdoors always safer than indoor again, but that is kind of the standard recommendation. And if concerns are observed, that's where we would impose that 14-day quarantine.
Thank you, Heather. This brings us to our 2 o'clock. I do want to remind everyone that Thanksgiving falls on the 27th, which is a holiday for us. And we will then be sending out a new messaging on the new dates for December in January due to the holiday. So I do want to thank everyone who's joined us today, and please stay safe, be well. And thank you so much for joining us. Have a great evening. Good afternoon. Bye.